Occupational English Test, Listening Test. This test has 3 parts. In each part, you'll hear different extracts. At the start of each extract, you'll have time to read the questions before you hear the extract. You will hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. 4 questions 1 to 24. Complete the notes with the information that you hear. You now have 30 seconds to look at the notes. Extract 1, questions 1 to 12. 4 questions 1 to 12. Complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Jones. I understand you've been experiencing some health issues lately.
Yes, doctor. For the last 6 months or so, I've been having trouble sleeping, and I often wake up in the middle of the night sweating and feeling anxious.
That sounds difficult. Is there anything else that's been bothering you, perhaps physically?
Yes, I've also noticed that I've been losing weight, even though I haven't changed my diet. I feel fatigued most of the day.
Have you had any other symptoms? For instance, have you experienced any chest pain or a shortness of breath?
Actually, yes. Occasionally, I feel a tightness in my chest after a meal, especially when it's something heavy.
I see. Do you have a history of heart problems in your family?
Yes, my father had a heart attack when he was 52. I'm currently 48, so I'm a bit concerned.
Understandable. Have you ever had any tests done for this chest discomfort?
No, this is the first time I'm mentioning it. I didn't think it was serious at first, but it's been happening more frequently.
All right. I'll arrange for you to have an EKG and a blood test to check your cholesterol and glucose levels. In the meantime, I recommend avoiding heavy meals and monitoring your symptoms closely.
Will I need to come back after the tests?
Yes, we'll need to review the results and decide on a treatment plan based on what we find. I'll also give you a referral to a cardiologist just to be safe.
Thank you, doctor. I appreciate it.
Of course. Take care of yourself in the meantime, and do not hesitate to contact us if your symptoms worsen.
Extract 2, questions 13 to 24. 4 questions 13 to 24. Complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mrs. Lee. How are you feeling today?
Not so great, to be honest. I've been dealing with this persistent cough for almost 3 weeks now, and I'm starting to feel more and more exhausted.
That sounds concerning. Have you had any fever or other symptoms, like difficulty breathing?
I've had a low-grade fever for the past week, and breathing feels a bit harder, especially when I'm lying down.
Are you taking anything for the fever or the cough?
I've been taking some over-the-counter cough syrup, but it doesn't seem to be helping much.
And how long have you had the fever?
It started about a week ago, but it hasn't gone away completely. It's usually around 100 degrees.
Given your symptoms, we should consider getting a chest X-ray to rule out any infections, like pneumonia. I'll discuss this with the doctor and arrange the necessary tests.
Is there anything I can do in the meantime to feel better?
Rest is crucial. Keep yourself hydrated, and if your breathing gets worse, please go to the emergency room right away.
Thank you, nurse. I'll do that.
We'll take good care of you. Let's get these tests done and figure out what's going on.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a workplace context. For questions 25 to 30, choose the answer, A, B, or C, which fits best according to what you hear. You now have 30 seconds to look at the questions. Dialogue from Extract 1, questions 25 to 30.
So, starting next week, we'll be implementing the new hand hygiene policy across all departments. Have you had a chance to review the guidelines?
Yes, I went through it briefly. It's mostly about reinforcing the 5 moments of hand hygiene, right?
Exactly, but this time there's a stronger emphasis on compliance monitoring. We'll be using electronic badges that track hand washing at key moments.
That sounds a bit invasive. How are staff reacting to this?
There's some concern, of course, but management assures us it's for patient safety. The badges don't track personal information, just compliance with hand hygiene.
I guess it's a necessary step, especially after the last audit highlighted gaps in our practices.
True, we had some breaches that could have easily been avoided. I'll talk to my team and make sure they're on board.
Thanks, that would help. We'll be doing a training session later this week to address any concerns.
Dr. Patel, I noticed you've been taking on a lot of patients lately. How are you managing with the increased workload?
It's been challenging, but I'm trying to stay on top of things. Some of the more complex cases take up a lot of time.
I've been there myself. Don't hesitate to ask for support when you need it. We're all here to help each other.
Thank you. I'll keep that in mind. I did want to discuss a particular patient with you. They're not responding well to the current treatment plan.
Sure, let's sit down later and review the case. Sometimes a fresh perspective can make all the difference.
That would be great. I appreciate your guidance.
That was a tough one. The patient's blood pressure kept dropping despite our best efforts.
Yeah, and the location didn't help. It was hard to navigate the stretcher through those narrow stairs.
Exactly. I think we need to flag that address for future calls. Maybe use the portable chair next time instead of the full stretcher.
Good idea. It would save a lot of time. I'll make a note of it in the system.
Also, we need to debrief with the team about our response. There are a few things we could have done differently.
Agreed. Let's arrange that after our shift.
We're rolling out a new digital system for patient records next month. How do you think the nursing staff will adapt?
There might be some resistance initially, but I think most of the team will welcome the change once they see how much easier it makes documentation.
We've arranged for multiple training sessions to ensure everyone is comfortable with the system.
That's good to hear. I'll make sure the team attends and provides feedback. It's essential that the system is user-friendly.
Definitely. And if there are any issues during the rollout, we'll have IT support available 24/7.
The patient's chart shows they're prescribed 5 milligrams of the medication, but their renal function is declining. You might want to consider adjusting the dosage.
Thanks for pointing that out. I was just about to administer the next dose. What adjustment would you recommend?
I'd suggest reducing it to 2.5 milligrams and monitoring the patient closely. Let the doctor know about the adjustment as well.
I'll do that right away. I appreciate the heads up.
In the event of a fire, remember that the first priority is patient safety. Make sure you're familiar with all the evacuation routes and assembly points.
Are there any changes to the existing protocol?
Just a few updates. We've added a new evacuation route in the West Wing, and we've also updated the fire extinguisher locations. You'll receive a map of the changes shortly.
Great. I'll ensure my team is aware of the new routes.
This is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear an interview or presentation with a healthcare professional. For questions 31 to 42, choose the answer, A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Dialogue from Extract 1, questions 31 to 36.
Good morning, Dr. Wilson. Can you tell us about the major improvements in patient care that have been implemented in your hospital recently?
Good morning. Certainly. Over the past year, we've made several significant changes. One of the key initiatives has been the integration of a new patient management system that allows for real-time updates and better coordination between departments.
That sounds promising. How has this new system affected patient outcomes?
We've observed a marked improvement in patient safety and efficiency. For example, we've reduced medication errors by 30% and streamlined discharge procedures, which has decreased hospital stay lengths.
That's impressive. What other measures have you taken to enhance patient satisfaction?
We have introduced a patient feedback tool that allows us to gather real-time insights into their experiences. Based on this feedback, we have improved our communication practices and patient education.
Have these changes resulted in noticeable improvements in patient satisfaction scores?
Yes, indeed. Our latest patient satisfaction surveys shows a 25% increase in positive feedback compared to last year.
Extract 2, questions 37 to 42.
Hello everyone. Today we are discussing dietary management for patients with chronic illnesses, focusing on diabetes and hypertension. It's crucial to tailor diets to individual needs while addressing their specific health conditions.
Can you elaborate on the dietary considerations for patients with diabetes?
Certainly. For diabetic patients, the emphasis should be on controlling blood sugar levels through balanced meals. This includes incorporating low glycemic index foods, such as whole grains and legumes, and reducing intake of high sugar foods.
And what about patients with hypertension? Are there specific dietary guidelines?
Yes, for hypertension, a low-sodium diet is essential, encouraging the consumption of fruits, vegetables, and whole grains while limiting processed foods can help manage blood pressure effectively.
How can patients be encouraged to adhere to these dietary guidelines?
Education is key. Providing patients with clear, practical advice and involving them in meal planning can improve adherence. Regular follow-up and support also play a crucial role.
Are there any new dietary trends or supplements that you recommend for these conditions?
Currently, there is growing interest in the benefits of omega-3 fatty acids for heart health and blood pressure management. However, any supplements should be discussed with the healthcare provider to ensure they are appropriate for the individual's health status.
This is the end of Part C. You now have 2 minutes to check your answers.